Good afternoon, everyone.
Good afternoon, everyone. Welcome to our weekly live session about plastic surgery. Today, we're going to talk about
Mastopexy without implants, which are those surgeries where we lift the breast, where we perform breast surgery without using implants. This is a perception that's not just ours. We still place a lot of implants. We do a lot of implant exchanges, but all of us, right, plastic surgeons, have noticed that we're living in a time in plastic surgery where patients are preferring to have surgeries without implants whenever possible, right? Implants are, well, medical devices. They're very safe, they're very well studied. But like everything in our specialty, there are times when patients have their preferences. And now we're in a phase of breast surgeries without implants. We've gone back to the 1980s, which was when we used to do this. The difference is that now the techniques have evolved. We now have a much more sophisticated technical arsenal than what we had 20 or 30 years ago. And that's what we're going to update you on. What are the best tactics and the best surgical techniques for performing this surgery? I think we should start by talking about who mastopexy surgery is for, right? What is it and who do we recommend it for?
mastopexy without prosthesis, without breast implants. Mastopexy refers to those surgeries where we reduce the size of the breast. When we reduce the size of the breast, the correct term would be reduction mammoplasty. So, a patient comes in who is satisfied with the size of her breasts, but is not happy with the shape and complains about sagging or drooping breasts. This patient, since she is satisfied with the size, usually does not need a breast implant. We reserve breast implants for those cases where we want to increase the size of the patient's breasts. So we recommend mastopexy without implants. And there are several surgical techniques to perform a mastopexy without implants. We are particularly fond of the autoimplant technique with support from a muscular band. Basically, we take a fragment, a segment of the breast. It is disconnected from the breast, but not from the patient's body. It still needs to receive blood supply, but it is loosened. And yes, it is moved upward and fixed higher up on the pectoralis major muscle. This is the autoimplant. It's living tissue that remains there receiving blood. And along with that, we release a strip of muscle and pass the autoimplant under beneath this strip. It is fixed up there, and this strip holds the autoimplant in place, just like I'm showing here with my hand. It's an additional support factor. It's a very interesting surgery with long-lasting results. There are scientific studies, at least one scientific study shows that when we use the muscle strip, the projection of the breast maintains itself for a longer period.
And it's critically important to always remember that the overall duration of this particular result depends very greatly on the inherent quality of the patient's breast tissue, among other contributing factors. I remember to mention this because this week I saw a patient in my office, a woman already in her 50s, already menopausal, who had gone through all the changes a woman's breast can go through, and she had predominantly fatty breasts. And that was a question she asked me, Doctor, how will my result turn out? Usually, when we have a consultation, one of our goals is to try to understand what the patient's expectations are. And what do we usually explain to patients? That when we use the patient's own breast tissue, one of the secrets is to keep the breast light. The breast can't be heavy, otherwise, it won't be able to support the shape we've created. And that surgical shape, right, which looks a lot like an implant, will have a certain lifespan. It will last about 6 months, sometimes a bit longer in patients with firmer breasts, but after a while, it will do what we call bascula. Bascula is that settling of the tissues that happens during the first year after surgery and will determine the final result. So it's normal for the upper pole to look a bit flatter, for the breast to have that little curve underneath, and for the areolas to face forward, right? That's the natural progression after breast surgery. And when we perform the surgery, we already take the breast measurements, those markings you see surgeons making, anticipating that tissue settling. Some breasts settle more and others settle less, right? And what are the factors, honey, that make the surgery last longer or not as long?
Well, the quality of the tissues, the quality of the skin, right? Thicker skin without stretch marks will hold up longer. Although we don't usually attribute to the skin this ability to withstand things. If the glandular tissue is very fatty, it will hold up for a shorter period of time. Patients who possess firmer, more dense and glandular breasts with a lesser amount of fat content will find that the aesthetic result of their procedure lasts for a longer duration. However, there is one crucial factor that we can effectively change, and that is the weight of the breast itself. Breasts that are lighter in weight will tend to stay lifted for an extended period because the force of gravity will have a reduced effect upon them. Now, a very direct question that patients often ask: will my breast become firmer with this surgery without an implant? The answer is no, folks. The breast will become lighter, it will have a new shape to the point where you can wear a shirt without a bra, the breast will look neat, but the consistency will still be that of the mammary gland. It's a completely natural result. If you want a firmer breast, then yes, you'll have to go for a breast implant. But that's only if you are a good candidate, right? If you have a large, heavy, voluminous breast, it's not a good indication for an implant. There's no way around it.
And I would even go further, right? No surgery, nothing we do will change the consistency of the breast tissue. The breast will remain the same.
And it's desirable it stays the same because it's a breast.
And what we do when we use an implant is basically replace what the patient has in terms of breast tissue with an implant. That's why it ends up taking on the shape of the implant. That's why it keeps the upper pole. That's why it becomes firmer. In fact, we remove 60 to 70% of the patient's breast tissue, and that is replaced with silicone. So there are things the patient needs to know before making this decision. We do this procedure a lot. We like the results, but the patient needs to understand how this will impact her life 10 years from now, for example. And regarding how long the results last, there are some things that really depend on the patient. And the main one is maintaining weight, right? The breast is an organ that is extremely sensitive to weight fluctuations. If the patient gains weight, it increases in size. If the patient loses weight, it decreases in volume. And what happens then is residual sagging. That's why pregnancy has such a big impact, right? So glandular breasts are the kind of breasts we have when we're 18 or 20 years old. We haven't had children. We haven't had big weight fluctuations. And so the breast has the consistency of a young breast. After pregnancy, it starts to age, right? It starts to become a little more glandular. It usually sags a little. And it will only become more pronounced with menopause.
The use of the bra prevents...
That's another myth. Yeah.
Breast sagging.
So no, the bra just holds the breast in the right place, but it's not the fact that the patient wears a bra or not that will make the breast stay up longer or make the results last longer. When we recommend those post-operative bras, what we're really doing is providing comfort for the patient and stabilizing the breast while it's still swollen. But whether you wear a bra or not won't make a difference. What actually matters is the weight of the breast, the volume it has, and the weight fluctuations the patient experiences throughout life. This directly impacts the result, right? The longevity of the results. One piece of advice we give to all patients is, what should you expect from surgery with and without implants? So let's suppose we have that borderline patient, the one who's right on the edge.
She doesn't know, right? Whether she wants implants or not.
But she could go either way. It's that patient who doesn't have a lot of sagging, but the breast is already a bit loose. The one who has a little bit of ptosis, right? Where the areola is already out of place, but it's not too droopy either. It's that patient who's on the fence. So for these patients who can choose what they want. So how should they understand the outcome of the surgery?
All right, so we always talk about the pros and cons. Getting a breast implant will provide a more defined cleavage and maybe a longer lasting fullness in the upper breast. That's inevitable. And maybe, if the patient has little breast tissue, a firmer, more solid feel to the breast. Those are the pros. The cons. We have to use a silicone implant, and at some point these implants will need maintenance, folks. When? Usually within 10 to 15 years. But aren't there any implants nowadays that last forever? No, there aren't. That's a myth. All implants currently on the global market will last about that long, 10 to 15 years. Oh, but I have a friend who's had implants for 20 years and she's fine. There really are patients in that situation.
We've had patients like that ourselves.
But that's the exception. After 10 years, the incidence of implant rupture starts to increase. Just as an example. So you know that the longer the implant lasts, the more time passes, the higher the risk of complications. Around 15 years, even if everything seems fine, we recommend that our patients replace their implants. Let's talk a bit about the practical side, shall we? How does it actually work? Patients need to go through preoperative procedures, routine tests, including breast imaging exams like ultrasound and mammography. The surgery is performed in a hospital under general anesthesia and lasts about 3 hours. At the end of the surgery, we like to use surgical glue, taping, and a post-operative bra. This bra is worn for 60 days, the taping is used for 1 week, and the surgical glue stays on for 21 days. From 15 to 21 days, patients are discharged on the same day. So this surgery is done as a day hospital procedure, right? You have the surgery in the morning, and by late afternoon, you go home, and then comes the rest period, which is where things get tough, right? For the first 15 days, patients have some limitation in moving their upper limbs, keeping their arms closer to the body, but not completely restricted. They can wash their face, eat, brush their teeth, and take care of all their personal hygiene. The only limitation is taking a shower, washing your hair, and combing your hair. After 2 weeks, you can already wash your hair, comb your hair, and you can do office work, light tasks. At 3 weeks, you can do light work. You're a bit more free. You can cook a meal, wash some dishes, do lighter household chores. And at 3 weeks, you can also sleep on your side. You need to spend 21 days sleeping on your back. After 1 month, we allow patients to return to work, drive, and have intimate relations. So after 1 month, patients return to their routine life. At 60 days, we remove the surgical bra and patients can start walking, cycling, and doing light gym workouts. And at 90 days, you can do everything: play volleyball, run, functional training, and that's pretty much it. Usually in mastopexy without implants, no glandular tissue is removed because the breast is already the appropriate size. But if any glandular tissue is removed, it is always sent for an anatomical pathological exam for biopsy. It is never discarded. This is standard procedure. It's the right thing to do. It's not just our own idea. This should be done worldwide, right? Talk a bit about fat grafting in these cases.
So in this situation with mastopexy patients specifically, what we use is fat to improve the shape, to contour the breast, and it can be used in various ways. It's like the finishing touch. I usually say it's like the cherry on top of the cake. So after we finish the surgery, we sit the patient up, assess the symmetry, and then small finishing touches, minor asymmetries can be improved with the use of fat. It's always important to remember that breasts, like anything that comes in pairs on the body, are never exactly the same. We make them less different than they were before, but they'll never be exactly the same. You'll always be able to tell which one was bigger, which one was smaller, and so on. But these small finishing touches, these little details can help minimize those differences, okay? Everyone, have a great week. And next Sunday, we'll be back with another topic about plastic surgery.